Okay. All right. Good afternoon, everybody. I want to say thank you for joining the first session of the MSN Know Your Value. This is going to be a brief discussion about learning how to write a CV. My name is Dr. Gwendolyn Godlock. I will be your moderator for this session, and I am super excited to be here. So what I'm going to do right now is turn it over to the panelists and I'll ask them to introduce themselves to you, and then we'll get started. Christy, you want to go first?
Sure. I'm Christy Kirkpatrick. I graduated from Vanderbilt in the Family Nurse Practitioner Program in 1996 and practiced in emergency medicine, first in family medicine for a few years, and then in emergency medicine for about 18 years. And for the last 5.5 years, I've been a senior clinical recruiter, recruiting nurse practitioners and PAs for a company called Team Health. We staff emergency departments and hospital medicine programs all over the country, and just very thankful to be here.
Okay. Christina?
Yeah, thank you for having me. My name is Christina Cardy, and I'm an adult gerontology acute care nurse practitioner. I completed my master's and my DNP at Vanderbilt in 2016 and 2017. And since that time, I've held roles in clinical positions, in academics, and in administration. In my most current role, I'm the program director for the adult gerontology acute care nurse practitioner program at University of South Florida. And I continue to practice clinically as an acute care nurse practitioner in inpatient cardiology.
Okay, thank you. So just a few administrative notes. We're going to ask you to put any questions that you may have over the course of the session in the chat box. And our goal is to ensure that we allow enough time in order to address each of those questions. And if not, Betsy's team will get back with you after the session and address those questions as they come in. So let's go ahead and get started. So I'm going to start with Christina, if that's okay. Can you just start off with sharing what's the difference between a CV and a resume?
Sure. I would say that a resume is more appropriate for a clinically oriented job, whereas a CV is more appropriate for an academic or potentially administrative job. A resume tends to be more brief, typically 1 to 2 pages, depending on the applicant's experience, where a CV tends to be very, very in-depth in terms of academics, publications, work experience, scholarly activities, service, mentorship. I think Christy can probably elaborate on that as well, having looked at so many applications in an HR type role.
Yes, thank you. Christy, can you expound on that, please?
Well, she is exactly correct with regard to the differences as they would be academically, but in this recruiting role, when I'm seeking a clinical position, we use the terms interchangeably. So we actually, if you want to add everything, that's great, but primarily we are looking for skills-based positions, clinical positions. So we use the terms interchangeably, but Christina is correct. I mean, if you are asked for a CV, that is really, you want to make sure you've got your publications and a lot of your accolades and things like that listed.
And I'm glad you clarified that, but it's one thing that you did say, skills-based. So can you just touch a little bit on what are some of the basic items that would go into a CV and or resume, since those words are used interchangeably in the industry?
I think that if you're seeking work as a nurse practitioner, that you're going to want to list you're a brand new nurse practitioner, you're going to want to list the jobs that you've had and then bullet point specific skills that are going to be applicable to the position you're looking for. So those might be venipuncture, suturing, EKG interpretation, splint application, just anything you have done that's going to be applicable to the position you're seeking.
And I'm glad you said that. So just what I'm hearing you say is that your CV and resume should align with the job that you're applying for. So the employer can see that you possess those skill sets in order to meet the organization's mission. And I guess to go on a little further, and Christina, please jump in, or either one of the two of you, what do you think should not be in there? Like, do you see extraneous information? I actually had an opportunity to review a resume that was 10 pages long. I mean, that's a dissertation or a mini. So can you just share with us what should not be in a resume or CV, either one of you?
Sure. So I would say a general rule, I would never include anything on a resume or CV that you're not comfortable or competent to speak about further in an interview. Number one, you don't want something on there claiming that you're an expert or a champion at something, and then, you're asked to elaborate on it in person and you really can't speak to it. And then in terms of extraneous information, some previous jobs can be relevant. Some of them are irrelevant. And I think that also depends on your depth of experience in nursing. For example, as a new graduate nurse practitioner, I would absolutely include all of my clinical rotations that I completed as an NP student. But now that I've been a nurse practitioner for over 5 years, for example, I've removed that information from my CV. Same thing goes with like service industry jobs. I feel like that's a very common question because there's a lot of, people working, excuse me, as like waitresses or hostesses. And that's a very customer service oriented role. And when you're working in healthcare, there are very, on stage and customer service oriented type skills that are needed. But again, once you've been out for a long time, that information doesn't really add value to your application.
It's a good point. And to your point, or when you talk about skills, don't put something on a resume that you can't speak to or back up. That goes to competencies. How do you address those competencies? And my assumption is, and correct me if I'm wrong, is how you speak to those competencies and how you've been able to demonstrate those on the job over the years. I do want to just go to Christy for a minute and tap into your expertise about those jobs. We're coming out of a COVID pandemic, or we're at the tail end, or however they framing it now, for nurses who traveled or students who, took on travel jobs. Can you share how can those different jobs, if it were many, because I know some nurses work somewhere for 6 months and another place for 6 months, how should those be displayed on a resume or CV?
You definitely want to put the travel agency name down. You're going to have to put the beginning and ending month and year format. That's huge. You have to show how long you actually worked and put the travel agency down, and then also list the facility where you worked. So maybe you worked for one agency, but you did, 3 different gigs in 3 different states. You just want to make sure that you're listing the facility. And then I would also, we saw some of our nurse practitioners unable to get nurse practitioner jobs. So they immediately, like you said, they went to travel nursing or something like that. So you just want to make sure that you are listing the facilities and maybe the volumes and the acuity that you were dealing with. Were you ICU? Were you working in an ED that was a trauma center? Or, that I think those things are important to list. I mean, that sort of applies to your skills when you're sharing the complexity of the patients that you're dealing with and the volumes.
And then how important is it for an applicant to know the organization before they apply? I know we're talking CV, resume. Should they also look at some of the specialties or some of the key areas about what the deficits are in the organization in order to better have the conversation with whoever the employee is about what their skill sets, what they can bring to the table? How can you put that on a resume?
I think in my particular organization, the actual organization is maybe less important than the facility to which they are applying. So if you have not worked in a regional emergency department where they're seeing just all levels of acuity, and I mean, you want to know something about the hospital to which you're applying. In my situation, that's very important. Less important, understanding, I can explain pretty quickly how Team Health works, that we're a staffing company and you're actually our employee, so you're going to be a guest in this facility. So that's what I would say about that, is really you need to know the job you're getting into.
And I'm glad you said that, because there's some misconceptions about, studying the organization versus studying the job that you're applying for. So I thank you for clarifying that. So Christina, if you could just share a little bit about how to tailor your CV and highlight some of your strongest attributes. A CV for me, 27 years of military service, I can't put all 27 years plus 8 years as a Joint Commission surveyor on one page, as well as you ladies. You have a breadth of knowledge. So what is the max and minimum, or is it, in terms of page limit and content?
Again, I think it's very specific to the position that you're applying to. So if you're applying to a strictly clinical nurse practitioner role, then you really want to expound upon the areas of your resume that are most relevant to that clinical role. So if you're applying for a position in the trauma ICU as a nurse practitioner, then all of your in an adult trauma ICU, then all of your, publications and volunteer work and service that you've done in like pediatric primary care, you want to include that, but you shouldn't be, emphasizing that on the CV, because whoever is reviewing it is going to say, why are they applying to this trauma role? All I see on here is pediatrics. So you really want to focus on, are they advanced trauma life support certified? Are they ACLS certified? Or maybe you put in the extra legwork and became like a stop the bleed instructor or something like that. Those are kind of ways to tailor and strengthen the resume or CV towards the particular role.
Good point. And Christina, can you expound on that, since we spoke quite a bit about skills and travel? How about publications? We do have authors of publications. How should those be listed on resumes or CVs?
So I would recommend having a section that's either titled scholarly work or scholarship, or, depending on if it's not published, but maybe you've done a lot of public speaking events, invited presentations, and just listing them in reverse chronological order of just, who was the sponsoring organization, what was the title of the event, what was the date, where was it, or in terms of publications, just adding the APA citation to the publication and including a DOI if you have that available, and just and you should bold your name in it, because typically you might be an author with like 5+ other people, so you want to see, highlight yourself in there.
And Christy, since you are on the end of reviewing all these applications or CVs, can you share from your experiences the format? If it's a preferred format, what type of formats are out there, or share an example of what one would look like? Can you help us with that?
I think that I actually have a couple of sample resumes that are just easy to read. I think that's the primary thing, because when you are applying for a position, just pretend there are 100 applicants out there and you want to get the information that's most important out there immediately. So I would discourage, I think this kind of goes back to your question about what you would leave off. We don't need a paragraph about what you're planning to do, your objective. It needs to be short and sweet if you're going to do your objective. But I think your name, where you live, your contact information, that's got to be first. And then list, I think when you go to a school like Vanderbilt, that you want to put your education up front. I'd put that front and center. I would not, talking about things you don't want on your resume or CV, your GPA. No one really cares. I mean, you can put maybe I graduated summa cum laude or something to that effect, but I wouldn't put your GPA. It just doesn't have it. And I've seen people put their GPAs that were not good. So it's
Probably
not,
not a
you
good
don't have
idea.
to do it. Don't do it. So typically, especially if you've gone to a program like Vanderbilt, I would put that, front and center, list your education out first, and then start with your work history, like Christina said, in reverse chronological order. If you have applicable clinical rotation experience to the job that you're applying for. So you did a clinical rotation in the hospital, the facility that you're applying to work in, or you did it, for example, with a team health physician or a nurse practitioner that works for our organization or the organization to which you're applying. You might want to put that in your clinical rotations, but otherwise your clinical rotations are not that important typically. And then get through your employment and certainly list where you worked, the location of where you worked, and the dates, beginning and ending, month and year format. And then below that, you can list, skills or awards, publications, other things, volunteer work, other things that you've done. And then a lot of people provide their references. You can do that. You don't have to do that, but I think it shows confidence when you provide some references. We're going to ask for them sooner or later anyway. So, and especially again, considering who you're applying to work with or for, you want to make sure that maybe those references are people who are part of the organization or people who are well known. Or
Good point. And while we're on the topic of what to include, preceptorships, would you recommend including those? If you were a preceptor, is that valuable information? Because it shows leadership. I mean, if anything else, what are your thoughts on that?
I would definitely, especially because a lot of preceptorships now are paid positions for folks. So I would definitely put that in as a role that you've had. You could put it in as employment, or you could put it in just additional work or volunteer work or applicable skills.
Yeah, I would say at the very minimum, if you're, precepting nurses or working as a charge nurse or something like that, demonstrating leadership in your bedside role prior to becoming a nurse practitioner, at the minimum, have it as a bullet point under that employment history, preceptor, charge nurse, those types of things, CLABC champion, whatever it is.
Mm-hmm. And since we're on that, steering a little way from that, let's talk about gaps in employment. The nursing staffing shortages are here and there. Can you just speak a little bit about how should one address gaps in employment, either one of the two of you or both?
I would say honestly, very honestly, just people have lives outside of their employment. People had to focus on education. People wanted to hike the Appalachian Trail. Whatever it is, just be honest, especially if you are applying to work in a hospital. You're going to be scrutinized like the President of the United States. You are going to be there. We want to know your history, all of it. So you just need to list your gaps of employment. In fact, our organization, you can't have a 30-day gap without addressing it. So a lot of times people list something like, I was studying for boards and seeking employment, or I was, it took 90 days to get privileges when I got my first job in a hospital. So, that's what I was doing. I was awaiting credentialing. So that's That's kind of a new, well, I say it's a newer phenomenon that it takes about 90 to 120 days to get someone on board in a hospital. But I know Christina has worked.
It took that long about 7 years ago, so not that new anymore.
Yes, yeah. Well, for me, it was 20 something. So you could walk into a hospital and get a job, and now it's just not that way. So it takes a while.
Let's talk about, again, the format, cover letter. Do you recommend a cover letter? Do you recommend cover letters for CVs or resumes?
In my organization, it's not necessary for clinical work. I think it's much more necessary, I think, when you're applying to smaller organizations, maybe, but I don't require it at all.
I think that the concept of a cover letter can be helpful, especially, as she said, in a smaller organization, and even in a little bit more of an informal way of introducing yourself, such as if you get the contact information for a practice manager or a physician in a private practice or a department chair or something like that, and you want to personally reach out to them and demonstrate your interest. It's a nice way to introduce yourself in a very polished and professional format, while also giving the excuse of, I'm attaching this resume or this CV to this correspondence, and feel free to reach out to me.
Okay. Now, do you think this is something that one could do, especially at this level of academia, that they don't have to pay anybody? Do you recommend paid services? Paid organizations, or pay someone to do a CV or a resume? What are your thoughts?
My personal thoughts, I definitely think that you should have a second set of eyes review it. I don't think that needs to be a paid professional unless you're, I guess it depends on the applicant's writing and communication abilities. But in general, I would say have your colleague or your mentor or your advisor or your partner, whoever it may be, just have them, spell check it, have them read it, make sure everything makes sense. But I don't think you need to go through a professional service for it.
And I agree with that. And I think what I would say to anyone who listens to this, or has access to this, you have access to me, and I'm happy to review your CV. So I've told them to, provide my contact information. I look at hundreds of these things. I can proof it pretty quickly, and I'm happy to help.
Let's talk about follow-up. So once the CV is submitted, resume, is it a time frame that you recommend they should circle back? Certainly 3 days is not enough time for them to read it. What do you recommend in terms of follow-up, or should anything be submitted on paper for a job? Christy?
I love it when people follow up a few days later. It indicates interest and desire and motivation and enthusiasm. And even when I'm really busy, I'm still very happy for them to follow up. So, and I've had some nurse practitioners who've just been relentless. They've wanted a job, and I may not have one, but things are changing daily, and you may catch me at the right time where someone's just resigned and there's an opportunity. So if there's something you want out there, follow up. Don't be afraid. If you're sending a text or an email, it's fine. I encourage you to do so. Give it a few days maybe, but don't give up.
Cool. Now, seeking tips, LinkedIn, what are your thoughts about LinkedIn? Putting your resume on Indeed, I think that's another form, I'm not sure. But what do you think about leveraging social media, the internet, those types of job hunting services?
In my personal experience, I haven't had a lot of very productive success on LinkedIn so much as maybe a non-healthcare position. I'm not sure if Christy's had different experience. I have a LinkedIn account, but I don't find it very healthcare friendly. With that being said, it is very easy and pretty intuitive to set up a profile, and it prompts you to put in information pretty much in a resume or CV type format. And you can add as much or as little as you want and sort of choose the option of, are you looking for a position or what is your current position? And with Indeed, it's very, very similar. In terms of job postings, at least locally in Florida, I found that most employers use Indeed more than LinkedIn.
I agree. That's my experiences as well. And Christy, do you have any additional resources that you can, from your experiences, that one could leverage?
We utilize Dot Cafe. That's a really common for healthcare. Is one that we use quite a lot. Do your research and look at, for example, our company. If you look there are staffing companies and you can get on their websites and find the jobs. So, and a lot of times we partner with the facility where we're recruiting. So if there's a job in a place that you want, go to the organization's website.
Okay, so that kind of concludes all of the content for the outline to cover. Are you all ready to jump? There's some questions in the queue. You all are ready to jump into those?
Sure.
All righty. All right, so there's an anonymous attendee and we're hoping, okay. How would you outline a resume for a new grad nurse practitioner with less than 1 year of nursing experience?
In terms of ordering information, is that my understanding?
The anonymous attendee, Betsy, can they unmute? Because that's.
I can unmute somebody.
The anonymous attendee, if Christina has would need some additional information, that's all they type. How would you outline a resume for a new grad nurse practitioner with less than 1 year of nursing experience?
I mean, I think in general, I would start it, obviously with my name and credentials and contact information, and then education. I would add all of my licensure and certification, and remember to include your license numbers and the states that you're licensed in and that sort of stuff. That's, really helpful for employers. It's also a really easy way for you to reference it too. Because depending on how long you've been a nurse, maybe you've racked up quite a few other certifications. And then I would put your clinical rotations ahead of your RN working experience, because that is most recent and most relevant to your what you're applying to and the role that you're trying to transition into. So clinical rotations, I would not call them internships. I'm not sure what Christy's experience is in terms of what people refer to them as. But I've seen some people write them sometimes as like a graduate internship, and I've looked at it and I'm like, I'm not sure what that is. And then it clicks, oh, this was your, your clinical assignment. Work history, and then I would probably go into, any additional space in terms of like your leadership or service, any kind of scholarship, philanthropic efforts, honors and awards, and like mentorship type opportunities.
I know when I was in school and I wasn't on the nurse practitioner track, more so the executive leadership, I did have a lot of friends that were on that nurse practitioner track, but they were having some challenges because they were finding that, I don't know if this is still the case from 2020 to 2023, that most employers were wanting 5 years or 3 years worth of NP experience before they could. So is that still the same temperament out there, Christy? Or
I have certain places that have an expectation of, well, they're just required. It's in the hospital bylaws that someone has to have 2 years experience before they can, as a clinician, not as a nurse. So I do have that kind of specificity in some of my facilities, but there are others that don't. And I think that your past experience, I have several people who were maybe EMTs before, maybe they were respiratory therapists before, maybe an x-ray tech, you just want to make sure that you're showing demonstrated experience, even if it's not as, as a nurse practitioner in the role that you're seeking. So if you can show that, even if you were only, for example, this person who is going to be a new grad NP with less than 1 year of nursing experience, what did you do in your nursing experience? Where were you working? Are you looking for an ER job and you worked in the ER? Are you, we worked in critical care and you're looking for an intensivist position? I think you can, you can steer that, you can direct your experience in that way that that if the hospital doesn't require, or the employer doesn't necessarily require 2 years of NP experience, you've showed demonstrated interest and drive and enthusiasm for what you're seeking.
Okay. The other question is, can you clarify the gap in work experience a little further? In my case, I had a career outside of healthcare for 15 years, and I'm not sure if I should just list my 10 years of nursing experience and not mention my previous career, or if I should leave it off as it isn't directly related to healthcare. So the non-healthcare experience versus the healthcare experience, should they both be added, or should it just focus on the healthcare experience?
In jobs with my organization, you're going to have to name those years. So if you were managing a restaurant, or you worked in real estate for a decade, or whatever it is that you did, you just need to name it. And if you had leadership opportunity, or you amassed awards, or whatever it was that you did in that time, or you were running a business with your spouse that, fixed bicycles, whatever it is, you need to name it and share it. And sometimes, and I was a lead APC and an APC manager, so I did some of the interviewing and hiring on site when I was working. And sometimes that extra life experience makes you a more interesting person. So I wouldn't hesitate to put that in. You don't have to you just have to name the dates and what you were doing and let it be known.
Because it's still work history.
Absolutely.
You have the history of employment. Yeah, okay. So we have Miss Leslie Price. If working for the same organization, but with multiple roles, can each be listed separately with skills performed within each role? Does this look bad to work for the same organization for a long time? So let's take part A. If you've had multiple roles in one organization, should you list those separately with the skills performed with each role?
I just have to laugh at that a little bit because I've been with the same organization for 25 years and I've had many roles, very different roles. The first, nearly 20 years was clinical and various roles within that clinical position. And then now as a clinical recruiter. So, yes, I think that's great. List these opportunities you've had for promotions and leadership, and you were a nurse, then you were a charge nurse, then you were the nurse manager, then you were the, CNO, whatever it was. Yeah, for sure.
And I'm going to ping Christina a little bit because your background is very diverse and you've had various different roles. Can you just share a little bit of that and how you started from school to where you're at now? Because all of that is I call it like baking a cake. Each ingredient leads to something good. So can you just expound on that, please?
Yeah, and I would agree with Christy as well, listing everything separately, because all of my roles have been, for the same organization in different capacities. And so when I graduated, I was working solely clinically as an acute care nurse practitioner. I was working in inpatient cardiology. And so I would share information, relevant to that clinical experience and those skills and the acuity and, areas of the hospital that I was seeing patients in. And then when I completed my DNP, I had an interest in healthcare leadership and administration. And at the time, we didn't have any sort of advanced practice provider structure, management, leadership, nothing at all. And just based on what I had learned while I was completing my DNP, I kind of came up with a needs assessment and a gap analysis and shared that with the department administrator that I was working with, of just, here's how I think that things could be better. And we would be talking about, how could we better structure this? How do we create a professional advancement pathway? Those types of things. And just from having those conversations, they came back to me and said, we're drinking your Kool-Aid. You've got some good ideas, and, will you come up with a job description of what you think is needed? And I was able to come up with, some attributes for a position, and that just got escalated up the org chart, and whoever was at the top was like, yeah, we agree, this is needed. And it came back, and I was offered a position, that I essentially created for myself that didn't previously exist. And it sounds crazy, but it's not as uncommon as you might think. So then I ended up in this leadership role. And I knew I was also interested in academics. That's why I did my DNP. I knew I wanted something either academic or in administration. I wasn't really sure what at the time, and was just interested in dipping my toes into both. And apparently I'm crazy and had a lot of time, or was just really efficient. But I started teaching adjunct at the time as well with USF, because in Florida there were only a couple graduated classes of acute care NPs in our area that were doctorally prepared. So there was a need for faculty. And I was already within the organization. So I started teaching as adjunct and working clinically. And then in 2021, I just sort of decided, for my lifestyle and stage of life, I wanted to switch roles to a full-time academic role, where I'm predominantly academic, and now I'm part-time clinical.
Thank you. I just thought that information would be valuable as I'm scanning through questions in the chat. So to get back to, I do see the anonymous attendee has asked, you mentioned that Indeed is an option for resume sharing. Do you have and this is either one of the two, do you have any privacy concerns when using public internet platforms?
I can definitely speak to this one. I personally use Indeed to browse for jobs, but I'm very hesitant to include a lot of really identifiable personal information online. In terms of social media in general, over the COVID pandemic, I was actually pretty active on Twitter, to the point that my handle got verified as a healthcare expert. I got the blue check mark, all that really cool stuff. It sounds great, but it actually turned into a really big problem for me, and I became the target of a lot of like online harassment and cyberbullying, where people were, looking me up and contacting my employer, and
Wow.
Lots of crazy people out there. So my personal feeling is protect yourself, and that's what I'll have to say about that. And I'm no longer on Twitter.
Gosh. Okay, so Ms. Rhonda Taylor, again, either one of the two of you can jump in. Should your graduate training location be listed as precept nurse, then the organization and your responsibilities, and the month and date on your resume? So look, do you want me to read that?
I think I just like it when it's listed clinical rotations, and then you have the month, year it started, month, year it ended, your preceptor, what the organization was, whether it was, Dr. Smith's family practice in Seattle, Washington. I was there from, February of 2017 to June of 2017. That's really, and then you can bullet point what you did while you're there, the skills that you developed.
Okay. Ms. Heidi Bradley, my experience goes back all the way to a CNA 20 years ago. Am I hearing correctly that I could include that and not just my RN experience? And do I include my RN clinical rotations? And it was so long ago, I couldn't tell you half of them.
I would say no on the RN clinical rotations, because now you're a nurse practitioner. So you would maybe want to include some of your NP rotations, but I would not include your RN rotations. And if you want to just put your CNA experience on there, I think that's perfectly fine to do. I think that's actually, it's kind of going to be necessary because they're going to want to know, at least in my organization.
I would agree. I no longer have any of my clinical experiences related to education on my resume anymore.
Okay, the anonymous attendee, perhaps we will know who that is, but many healthcare organizations and other companies use ATS, applicant tracking system softwares, to vet resumes before they are sent to a recruiter. What tips or recommendations do you have for formatting resumes to increase the chances of making it past the computer screening and onto the recruiter's desk? It's interesting.
I'm not really sure, honestly, how that works, because I get them all. I mean, I get them all. I've gotten people who are confused about what I'm hiring, and they're not qualified in the least. So I'm not sure how that's working exactly.
Do you want to expand or follow up? Yeah, because I'm not in that business, but I don't know if they have buzzwords, or are you asking, does it screen for certain words?
I really don't know that we screen out.
Right.
I mean, I'm a senior clinical recruiter. We have clinical recruiters. We have people who are more sourcing. So they might be doing some screening, but things still get to me that, that I'm reviewing myself. So
I would agree with that. When I've reviewed positions, when I was working as a director of advanced practice and I was writing job descriptions and reviewing applications, we were an inpatient service in a medical surgical specialty in a critical care setting. And, one of our criteria was you had to be acute care certified, and we would still get, 70% of the applications would be adult primary care or family certified. And, I wish that I could have had those weeded out for me before I had to go through them.
So where is that computer service she's talking about?
That's what I'm saying. Maybe we need to work on that business.
The ATS, applicant tracking system. Okay, so that's the last question in the Q&A. Any other questions from anybody? Betsy, are you seeing any? Or any of the?
I don't see any more. Thank you.
All right, so if we don't have any other questions, Betsy has included Christy's information. Have you? No, an example of the chat.
Oh, I see one question that just came up again about gaps.
Okay.
And it's an interesting question, actually, because it's something that I don't think HR can legally ask you, but how would you acknowledge a gap if it's something for like pregnancy?
I typically just have my applicants, I tell them, raising a family or medical leave, or, it just needs to be addressed that you were not working, you were doing something else. Like I said, it can be travel abroad, just name it. And that's perfectly fine. It just needs to be covered. That's all. It's part of the hospital application process. It's part of our company being able to cover your malpractice insurance. There are several layers to it, but just name it. And you don't have to name it specifically. You can just say family leave, or, I've had all kinds of applicants have all kinds of situations, including incarceration. So, there may be, you never know. Just name it as honestly as you can.
Okay, here's two more questions. If you completed a fellowship, how would it be best to advertise this on your resume?
I would say putting it at the top of the work experience. I would put the fellowship, and then I would still put your nurse practitioner clinical rotations, and then I would go into your employment history.
Okay. Miss Rhonda Taylor, what about pics on the resume? Do you recommend pictures?
It's not something that was ever done 20 years ago. And I have maybe 20% of the applicants, 20% of the applicants that I receive have their photos. It doesn't matter.
I always thought it was a little weird, but that was my personal feeling. I feel like with technology now, if you're curious what someone looks like, you can usually find their picture. I don't know.
Well, that's kind of what I wanted to mention when you were talking about social media and the use of social media and uploading your resume onto these platforms. I mean, I've really, my information is really out there as a recruiter, and but really all of our information, so much of our information is out there if you participate in social media at all. So I don't routinely do this, but some of my recruiter colleagues, I mean, they immediately go to Facebook when someone applies that they're interested in.
And I have to apologize to April Kapoor, doctor. I responded to her question by saying, hi, but she had a question. So her question got zapped. So let me go back to your question, April. I was just so happy to see you. Can you show an example? Can you show the example again? Was that the example of the resume or what was written in? I know Betsy had typed in like a template to share. Is that what you're referring to, an example?
I think April should be leading this meeting.
Hey, April, there she is. I'm sorry, I got excited. So is that what you're looking for, an example? Can you unmute her, Betsy?
Yes, I was wondering if you could show the example for the audience again, if that was possible. And hi, Gwen.
Hi. So the example. Christy, can you share your screen?
I have like a couple of sample resumes. I turned my light off so that it wasn't so bright in here. Now I can't see. So hang on a second.
Okay, so while she's queuing that up, let's go ahead and address these last couple of questions. You mentioned Doc Cafe for openings. I went on the site while you were answering questions. Doc Cafe is focused on physicians and physician assistants. Is there a way to find NP positions?
That's a good question, because I actually get nurse practitioners as well through Doc Cafe. So I just know that that's one of the sourcing. That's where some of our sourcing comes from. I think there's ENP Network for emergency nurse practitioners. I can actually follow up and send Betsy some more information if she wants to distribute it to the people who've RSVP'd.
Okay, I did see a couple of comments where people felt that this was very helpful. And that was the intent, to make this a meaningful experience. So I have another question. Are you ready? Let me know when you're ready to queue up, Christy.
So this is, let me see if I can go to share. Let's see, oh, share screen, all right. This is a resume that was just easy to read, and it is pretty wordy, but it does have the dates as, let's see, share.
There you
You
go.
guys see this?
Yep.
So her name listed at the top. This person was an EMT paramedic before, their address, their phone number, their email, what they're seeking, and then their dates and month year format and what they did, their positions.
Okay. Now, I just want to pose a question. Is it somewhere that you would recommend, Christy or Christina, like a resume template guide, or are there books like resumes CVs 101 or any resources like that that would help in beginning someone who's very new into trying to get into the industry? What any resources they can tap into?
I mean, if you just get online to do your resume, you will get templates immediately. And I don't have any problem with those. I think it's fine to use just what looks the most organized and what's going to be the easiest to read. It doesn't necessarily have to be pretty. It just has to have the information in it that we're seeking and that you want to display to show yourself off.
Okay.
And I would add that if possible, share it as a PDF instead of a Word document so that you know exactly what it looks like when you're uploading it.
Good point. So we have the anonymous attendee again asking, and we appreciate all the questions, so keep them coming. I wanted to ask again, how would we title clinical rotations? And what if we don't have multiple clinical rotations, but instead one clinical placement for the length of your NP program?
So I think if you look on this example that is shared on the screen, it's titled as clinical experience. And you can see there, it looks like they probably consolidated everything together. But I was in your same situation. I did the same clinical rotation for all 3 of my clinical semesters, or for the entirety of my required hours. And I just mentioned that I put the number of hours that I completed. I put the time frame that I was in clinicals with that group, and I just really elaborated on, we were a critical care consult service that saw patients in, 11 different ICUs in the hospital. These are the skills that I had experience performing. We were at a level 1 trauma center, that type of information. I don't think that that's a red flag at all that you only had 1 clinical rotation.
Okay. Ms. Jillian Reed asks, what if you have 10 years of clinical experience as an NP and you're hoping to transition into a non-clinical position? Do you have any recommendations for additions to make to your resume? So going from clinical to non-clinical.
In that case, I would say emphasize your leadership. So many nurses and nurse practitioners have had opportunities in leadership, have done things like what Christina, not so many have done things quite like Christina creating her own position, which is really impressive. But, a lot of nurse practitioners have done so many things outside of their clinical roles, even when they've been working clinically full time. And I think those things are important to share as aspects of the position that you're seeking. And a lot of that depends on what kind of non-clinical job are you looking for exactly? What are those needs? That's one of those situations where I think Gwen was a little bit referring to earlier, is where you really just, you want to know what they're looking for and you want to emphasize your experience with that. And a lot of times it helps to talk with a colleague or with someone who's doing the job that you're seeking. And they can actually give you some perspective on some of the things that you've done that you may not realize are very applicable to a non-clinical job.
If I could just add one thing, coming out of the military for 27 years into what we call the civilian sector, but the language is so different. So, making that transition and having to, I actually sought assistance, specifically going from active duty military to the Joint Commission. That was a huge leap. But you were able to, you have to massage it in order to translate what you did prior to, which would be the same thing in a non-clinical, clinical transition space, in order to make it work. So it's a little crafty, but you can make it happen. The last question is Mr. Joshua Thornsbury. Can you provide recommendations about where to place activities such as an item writing for standardized examinations and participation as faculty at a national conference on your CV?
I know on my personal CV, I have those types of items under a section called service. But that's directly related to, our professional advancement as faculty in terms of how we get promoted. And we're evaluated on our, our clinical work, our scholarship, and our service. And service would include any sort of committee work, or participation at, local, regional, national, international levels, that type of thing. Hi, Josh.
All right, Miss Melissa Coleman, I missed the very beginning, so I'm sorry. No need to apologize. If you already addressed this question, but should I have continued education on my CV? It is mainly different conferences attended over the years, which makes the CV quite long.
I don't have any on mine. If I spoke at the conference, I have it listed, but if I just attended, I do not.
They will usually get to that kind of thing in terms of your CME. They'll ask those questions on your application. You've been in practice for a while, but just attending is not usually anything you'd like out on your CV. I have another one that looks a little bit different that I can share also, that was just easy to read and has the required information if you want me to share again.
Are you guys open? I guess we can look at it quickly. We still have about 3 minutes.
It's just another one that's a little bit different, but still easy to read, straightforward.
Mhm.
All the dates are in there.
Okay. All right. Any further questions from anybody? This has been great. Thank you so much. Okay, so I think we're going to wrap it up here. Any final words from anybody on the panel, Christina or Christy? Any words of encouragement, terms of endearment, anything?
I would just say, again, thank you for having me, and thank you to our audience for being active participants. It's always more fun to do these things when you guys are engaged.
Right. Christy?
I would second everything that Christina just said. And also, prior to everyone getting on the call, I was telling Betsy that going to Vanderbilt and becoming a nurse practitioner was the best decision that I'd ever made in my life. So I wish all of you the absolute very best. And you're just about to do a great thing. So thank you for letting me be a part of it.
Great place, great brand.
Yes, go doors, right? So this concludes session 1 of our MSN Know Your Value. Again, thank you all for participating and attending our first session. Any further questions, please forward those to Betsy. And if I'm not mistaken, Betsy is going to share Christy's information. So if you have any additional questions that you would like addressed about CVs or resume writing, she has made herself or offered to make herself available at no cost. So that's it. You guys have a good evening and enjoy the rest of your week.
Bye, everyone. Thank you.
Bye.
Thank you.
Bye-bye.